Hello, I'm Kate Castro, and I will be discussing with you the commonality of injuries in youth sports and the causes of those injuries. Now, throughout this presentation, I will go over the pattern I noticed in the original research articles I used, some of the missing evidence, and my research question. From there, I will discuss the article that helped to guide my research, my findings, and the implications of those findings, and any recommendations I would have for future researchers and citizens, and then I will end with my references. Now, as for common patterns in the original research articles, to start with Cobb et al., they really went into the topic of head impact and trauma, otherwise known as traumatic brain injuries or TBIs. And for the method, they equipped 50 youth football players in the state of Florida with helmets equipped with the HIT system. And the HIT system consists of multiple single axis accelerometers that were mounted to the children's helmets to record exactly how hard and how often they were getting hit and or hitting others. And as this recorded the amount of force that these kids were taking from the blows to the head over the course of a season, they found that the amount of force being used in their practices was equal to the amount of force being used in games. And then, as Anthony et al. Dived into the topic of overuse and a lack of rest, which mostly applied to multi sport athletes, their method was to use questionnaires that they dispersed to patients visiting different university based sports medicine clinics in both the United States and in Canada. And through that, they found that fatigue was the leading contributing factor to the injuries that these athletes were experiencing at a young age. And they acknowledged that overuse injuries can occur as a result of repetitive microtrauma from chronic submaximal loading of tendons, muscles, or bones beyond the necessary requirement without any time to rest and recover. And so people really have to take into account that whole rest and recovery concept. And then the Di Fiore et al. From 2014, they directed their focus also to overuse, but with an emphasis on the common stress factors that often take place in youth sports. And overuse injuries are of a really high concern right now because of the serious long term effects it can have on the body. And as their method here, Di Fiore et al. Used cross referencing, and through that they found that 48.5% of young athletes have spondylosis, which is a stress fracture of the spine. Now, the trend here is that there's a lack of information on how to stop these injuries from occurring. And that leads me to my topic of missing evidence. Now, while they have discussed the common injuries and while they've even noted how these common injuries are happening, they still haven't thought to explore the prevention side of things. There's a serious lack of evidence on successful prevention techniques and methods. There needs to be more research so clinicians know what to prescribe or suggest their patients due to avoiding to fall back into victim of these extreme long-term injuries and the effects it can have on these youth athletes' bodies. Now, going through all these steps throughout the semester, it led me to my research question, which it initially started with what common injuries are taking place the most often and in youth sports and why? And then I found through the gap that I wanted to really touch on as well what modes of prevention or prevention techniques can be the most beneficial in limiting the number of times kids are falling victim to these injuries. And then I found my helper source, and it really was a source of direction in my research. And it helped to direct the paper in the right way as it tied in all the themes used in the paper. I really had three themes in mind that I really wanted to use, and this helper source really stood out because of its different take on the cause behind the youth injuries. It was Stracciolini et al. From 2016 that delved into the lack of safety for the children involved due to the relative age effect. And that relative age effect is the age cutoff that says if you were born at this time from this time to this time you could play this sport, but if you were born a day after this cutoff, then you have to play up. But what's happening is the younger kids are playing with kids 11 months older than them, and these kids are overdeveloped compared to them, and they're experiencing a lot of injuries there. Now, for my finding, this was the same answer that I originally solicited through my research, and it's that most common injuries in youth sports are stress fractures and traumatic brain injuries, which can be concussions and things of that nature. Now, stress fractures are mostly due to the overuse and a lack of rest, putting a lot of stress on those tendons, muscles, and bones. And the TBIs usually occur due to an overdevelopment amongst youth athletes in contact sport, which relates back to that relative age effect from that helper source of kids of an older and more mature stature playing with smaller kids and then having to contact. And another finding was that some beneficial prevention techniques include resistance training, structured pre and post competition exercises, and a reevaluation of that age cutoff. And this is what I would argue for, because growing up playing sports myself and now coaching youth athletes, I see a lot of these injuries take place often. And through resistance training with their personal trainers that we provide for them, there has been a decline in the commonality of those injuries. As for the implications of my findings are confirmed by how I correlated my themes to my helper source. It was a big factor for me and helped really bring everything together in my paper, which is the article by Stracciolini regarding that relative age effect from 2016. And in that article, Stracciolini explored the common injuries and how they're happening and why and how to prevent them. And she filled that gap. And my motive here was that the study is important because 89.62% of adults in the United States have kids, and 3 out of 4 of those kids play an organized sport. My study stands out compared to others because it actually explores the benefits of prevention techniques and methods unlike others. There's a huge lack of research there in that area. And there's so many kids playing sports, and if the risk is this high of them to be playing and suffer these long-term effects, there needs to be more information about it. Now, any recommendations I have for the future researchers that would pick up where I left off is that they should use all those different risk factors that have been explored by previous researchers from the 9 sources I used in my paper to conduct a study and discover which one is the most pretentious. And then for citizens, I think that they should really educate themselves to become more aware, as well as use some of the prevention techniques to see if one is more effective than the other, including clinicians, parents, coaches, anyone involved in organized sports should really find out ways to decrease the frequency of how many kids are experiencing these injuries. And here is my references. A quote from Cobb et al. Is that head impact exposure in youth football has not been well documented, and that's been a big controversy lately in the youth sports world especially, and even in the NFL. And then a quote from Di Fiore et al. Is that among the youth athletes who participated in the study, who were evaluated for back pain, 48.5% of young athletes were found to have occult spondylosis. And that is my presentation on the commonality of injuries in youth sports and some prevention techniques to keep those from happening. Thank you.